I'm Corey Minnick, and I'm a crew chief for Florham Park First Aid Squad. And the ambulance is it's a self-contained emergency room. I mean, when we need to, we can call the medics, and we can set up IVs. They can set up IVs in here. We have oxygen. This is what's called our jump bag. This is the blue bag. We use that for when we actually get to a call. We need to go to the patient and we do an assessment on the patient, find out what their needs are, and whatever interventions that need to be done, we can use directly out of the jump bag. Oxygen, if they're bleeding, anything like that, we have in the jump bag. Then we usually transport them. We'll use the stretcher, but we also have other devices that we can use to transport: backboards, stair chairs. If they're upstairs, we can bring them down using the stair chair and put them on the stretcher. And then once we're on board, then the interventions, we recheck our interventions. We reassess the patient, vitals, all that sort of thing, which is like blood pressure, pulse rate, oxygen saturation. And then what we'll do is if we need to, we can transport it. We can take the oxygen off the jump bag, put them on the onboard oxygen, and then we transport them. And then we'll call whatever hospital we're going to, give them a report, and so they're ready for us. For instance, like for special cases, like somebody has a stroke, it's really important where time is a factor, and you want to get them to hospital as soon as you can. Same with a trauma patient, any kind of like heavy-duty interventions like a tourniquet or anything like that. Most of the time, we can stabilize the patient in here, and if they're unstable, we recheck them every 5 minutes. If they're stable, it's every 10 minutes. We have all sorts of patients that come on board. I mean, from routine transport, somebody who's sick and has chronic, to acute, to motor vehicle accidents. We have the capability to cover almost every emergency in Florham Park.
Okay.
And if we need to, we can call upon paramedics as well.
Okay.